Prabhandar. Good afternoon, everybody. Thank you so much, as always, for making time for this meeting. It's great how diligent people are at attending. It's really important to us that you do. So we have a slightly flexible program today, because we've got a number of people speaking, and some of them are not able to come when we thought they were. So we're going to slightly play it by ear. So please bear with us. But we're intending to get through all the items on the agenda, but possibly a little bit like Andre Previn. They may be the right notes, but not necessarily in the right order. So we'll do our best. And today's meeting is focused, as I hope you know, on priority 2, which is about health and social care. A cause dear to my heart. And we have, I think, some really interesting presentations and discussions to have. And we're very keen to hear about you, to hear from you as always. So we have our traditional breakout session, which may or may not be at 2:20, depending on how we're doing at that point. So we are hoping to hear from Mike Emery at some point. He thought he was going to be here at 2:30, but I'm looking at Sarah's face. I think he's probably not here yet. So what I suggest we might do is, we're very lucky also to have Carolyn Williams. So Carolyn is Head of Digital Innovation and Transformation at Hywel Dda University Health Board. Her colleague Michelle Higgin, who was also going to speak, unfortunately is not well, so she's Carolyn kindly going to speak on behalf of both of them. Hywel Dda is one of our exemplars, really, because it's the health board that has probably most embraced the question of digital inclusion in health, and to the extent that they have a digital inclusion manager and a team, and are doing great work, and had a very nice conference earlier this year, which we spoke at. And so Carolyn's going to tell us a little bit about what's going on in Hywel Dda. And I'm really looking forward to hearing it. So, Carolyn, would you mind going a little bit further up the agenda than you were expecting?
Yeah, no problem. Thank you very much, all. And yeah, it's just real pleasure, really, just to have the opportunity to come and talk to you. So I'm going to try and do the share screen thing. Oh, posted disabled attendee screen sharing. So I don't know whether you need to do something.
Yes.
Sorry, or whether you want to do the slides and I'll tell you to move on. I don't mind.
No, we just need to click on the.
You should now be a co-host, so you should be able to share. If you run into any trouble, I can do it for you.
If you just click on, yeah.
It's working now by the looks of it. Okay, hopefully if you can let me know if that is sharing for you.
It is. It's sharing, but not yet in presentation view.
A moment. How's that?
Perfect.
Okay. I'm only on the one screen at the moment because some other work going on in the house. So if I run through it and then take questions at the end, because I can't see any hands or chat at the moment, is that all right with everybody?
That would be very good. Or we might, in fact, take questions to you and Joe Dundon, actually. So just work through it, and then we'll have questions after Joe.
No worries. So I suppose just to give you a bit of background, a bit more background really to Hywel Dda, I think really we didn't really start our kind of rapid transformation journey probably to about 2020, 2021. And most of that was focused around kind of 2 key themes, really, around our patients and our workforce. But we started coming up with what our actual digital transformation program needs to look like. And, you know, as many organizations, we'll have our strategy, we'll have our plans and objectives and everything else. But when myself and Anthony were kind of sitting down and thinking about how we're going to make this happen, we were just very conscious that we could not have the kind of been done to approach, and that our transformation work was only going to be as successful as it was embedded into our communities. Because at the end of the day, the approach in health very much was changing. We were very much focused on the fact that patients need to be empowered to be able to actively manage their health on a day-to-day basis. and for wider communities. So for those people who aren't patients at the moment, we want to make sure we do everything we can to enable them to stay well and live healthy, so that actually wherever possible they don't need our support, they don't need our services. It's about prevention at the end of the day. So we need to think about how would we embed digital transformation in our communities, and then how would we also help our workforce to work differently as well. So this sort of then started culminating into the fact that we need to understand what is it that our patients, our staff would need to be able to do to be able to access digital solutions. So we started doing some research, and we found the widening participation research paper was extremely useful. We reached out to other organisations as well to find out what they were doing in different parts of the UK. And we started to build up what we saw were kind of 8 pillars that would help us to embed digital inclusion across the Hywel Dda region and across our health board. So these 8 pillars reflect those pieces of work that are quite important to us. So the first one there is more about just recognizing how digital can play a key element of accessing health. And we need to make sure that where patients are excluded, for example, that they still have routes to access health that isn't reliant on digital, but also that it then excludes them from maybe being able to access resources that they're not currently benefiting from. 2, co-designing, very important aspect. It's about user-centered design. It's about working with patients and services to understand how we support those health programs. 3, this is what we're all here for. It's about digital literacy in the population. So it's about working with organisations. It's about working with a third sector who play a key part with us, working collaboratively. 4, it's about where we do any kind of new builds, designs and everything else, or where there's an opportunity to just take stock, whether it's working with a local authority or perhaps a new health centre, for example, that we look for opportunities to see how could we make digital accessible to people in our communities, particularly those deprived areas where perhaps access to data, for example, on their phone or whatever is an issue, or perhaps some people who aren't as confident accessing tools, etc. The others are kind of self-explanatory, but the one I'm going to touch on further on is about our workforce skills as well. So this was our journey really in terms of what we needed to do to kind of as an organisation is really embed digital inclusion as part of the way that we work. So initially it was about getting sign off from our exec board, signing of the charter, and then actually then having someone that would actually then help us deliver that programme of work. I would say that having someone who can actually then focus on the programme is absolutely essential, because it's about raising awareness and helping people to think about how digital inclusion can be incorporated. Lots of people often think that it costs money. I would say, I'm not going to say we've done it on the cheap, but it hasn't always been about money. It's just been about thinking about the design. It's been thinking about how you work collectively with other organisations in your region to make the most of the resources and the support, and the volunteers play a key part in the work that we're doing across Hywel Dda region. To give, because I know we're short on time, one spotlight I wanted to focus on was I don't think we really fully anticipated the level of work required to support digital inclusion in our own workforce. And so we recognise that there are people in our workforce who may have come through life and got on quite well without having to use digital as part of their professional role. We think about people like hotel services, think about estates. All of a sudden, they were potentially asked to do things digitally, and that can cause people to be really uncomfortable. We've got a number of clinicians who perhaps this is not their area of interest, but they've now been asked to work differently. And so we've put together this kind of suite of resources really, and options to support staff to raise up their confidence in using digital. We focus very much on ensuring that we can understand the benefits of digital realisation from digital inclusion. This is something that we've embedded across digital, but is actually being embedded across the health board and seen as good practice. And you're probably seeing something very similar to a provider. We're kind of closing the rings in some respects. So this is an example of where we've done digital inclusion sessions. So teams can self-refer, or someone can refer in, and then they receive some kind of digital inclusion support, which then builds up their knowledge of how to safely use digital technology. So the idea, it's not just about the workforce requirements, but it's also that it's then overlapping into their personal lives as well, where they might be helping other people in their family and community. So it's a win-win for us when we support our own staff. And so far we've had some really positive feedback from this. This is kind of some of the comments that we have back from people who've done the digital inclusion awareness sessions with us. We have also done a lot of raising awareness sessions across the organisation, so people actually anticipate that they might need to think about digital inclusion before they just go off and buy a new system, because often we know that the successful change programs can often be impacted by the confidence that people have in taking on a new aspect of work. It can put up a lot of resistance to change. So we feel that this is actually, it's an investment going forward in the kind of work that we want to do in the future. And this is just to give you a very quick snapshot of our workforce. So we're seeing that the highest percentage of staff who require support with digital inclusion is actually our clinical staff. Can be difficult sometimes because obviously they're working clinically, but our team will do our utmost, even if it means going onto the wards and everything, to be available to support them so we can try and address their concerns. And then this is just a very quick overview, just conscious of time, of what we're doing in terms of 2023. So we find that our regional digital inclusion steering group is growing. We love the input that we get from colleagues. It enables us to reach out and find out what support services are out there, but it is very fundamental to ensuring that those hard to reach groups, those groups that are representative of patients who have a disability, are included as part of any of our work. So we ensure that any new digital transformation programs and projects fully consider digital inclusion as part of their delivery program before they go live. And then we've got some few other bits and pieces there that we're working towards throughout the rest of the year. So I hope that's what you were hoping to hear today.
Absolutely. It's inspiring, Carolyn. So thank you very much indeed. What I suggest we do now, if I may, is hold questions for Carolyn. I'm sure there will be several, and then we're just going to hear from Joe Dundon from Digital Health and Care Wales, who's going to talk about the way that public have been engaged and how digital inclusion has been considered in the NHS Wales app. So, Joe, are you here? And if so,
I am. I'm just going to check. Fingers crossed. I usually have problems with. Oh gosh.
While you're getting your slides up, can I just check, Karen? Are you happy for us to share your slides?
Yes, that's fine.
Lovely, good. So the answer to that question in the chat is yes. Lovely. Off you go, Joe. You can see your slides.
I can't. I've got a blank screen now at the moment, so which doesn't help. So bear with me. Oh, hold on. I think I'm going to have fun here today. I don't. For some reason, Zoom. It never works with Zoom right. Hopefully, there you go. I've got.
So we can see your slides, but not in presentation view.
Right, and I have no idea how to move that into anything because I've got a blank screen on the screen. Actually,
then I'll tell you what.
I'll tell you what. I'll ask Laura said that she can show it for me, so that might be easier. So I'll stop sharing. So sorry, everyone.
Yeah, no problem. Give me 2 seconds, and I will get everything shared. The irony isn't lost on me that you guys will all see a video with me in it. It's because I'm not supposed to be here, but I am here. So yeah, you get me twice. Okie dokie. Can somebody let me know once you can see the screen?
We can see the screen.
Perfect.
Brilliant, thank you. My monitor's completely packed up now, so if you see me looking at a different angle, that's why. So, but no, thank you very much. So, Laura, if we would put all our names, both our names on the screen, and I'll just give a bit of an introduction. There we go. See, it's working fine. See, I got the same problem. So, there we go. So, thank you very much indeed for inviting us to talk to this afternoon. As you'll hear throughout, Laura and I have been working very closely with Sarah Woolett as well on digital inclusion in DHCW. So we have a small working group within Digital Health and Care Wales on digital inclusion, and our Chief Executive, Helen Thomas, has agreed to be the executive lead for digital inclusion, so showing how important it is for the organisation. As part of this, I'm the National Digital Lead for Public Engagement in Digital Health and Care Wales, and the engagement lead for Digital Services for the Patients and Public programme, and very, very keen that the patient voice is included in everything we're developing for the NHS Wales app. So what we're going to do is just give you a little bit of an overview of some of the work that we've been doing within DSPP, and to give you some examples of some of the work that we've been doing on user research as well. So if you want to the next slide, Laura. So just fireworks that to show that the app, the NHS Wales app, is actually live, and has been live now for a year, but we're still in public beta since April. And this is really a plug for you for the next slide to show that what we're doing so far. So you can actually download the app now through the App Store and Google Play, just searching for NHS Wales app. And we do have 2 bilingual web versions as well. So again, just App NHS Wales and App Geek Cymru, and hopefully you'll be able to get in. We're asking people to register through the GP search function that we've built in. So if your practice isn't live yet, and we've got a rolling programme to get the EMIS practices in place by the end of November, and the rest then of the Surgeon practices by March next year. So the next slide. So the journey so far. So in the fact that in the space of 18 months, we've actually managed to get an app live, I think is pretty impressive. So we have now, I think, nearly 8,000 people have registered and downloaded the app. We have over 50 practices live, and there's a lot of other bits of work that we're doing, not including digital medicines, which Hamish is involved in as well. And to the next slide. So what can you see today? Well, we have access to resources to help people manage their health and care. You can search for your blood and organ donations, preferences and decisions. And once you get in and you get connected with your GP practice, you can order repeat prescriptions, access your personal GP summary record, and maybe a detailed coded record, and book and cancel GP practice appointments. On the next slide, we have, so what also we're developing is a health timeline, so you'll be able to search for appointments and notes. You'll also be able to keep a wellbeing journal, and also a lot of work now going on prescriptions management as well. We have actually started to add in some local services, sorry, Laura, in your through the app, and the aim is to try and get more onboarded accredited services available as well. So there's a lot of work going on. So on to the next slide. So this is just to give you the timeline of that we're hoping then to have the full operational service in place by April next year. But as you can imagine, we still want to build on that as we go through. So how do we build all this together? Well, we do a lot of work on user-centered design from discovery to public beta. We were fortunate in being able to get the code base from England for the NHS app there. So if you look at it and you've used the NHS app in England, there are some similarities in the look and feel of the app, but we've also tried to dragonize it for Wales. So in making sure that we get patient involvement, we've had a patient involvement survey available on the DSPP website, and over 1,145 people have completed this. We also get requests through the Patients and Public Assurance Group, which is a group I chair and has been in operation since 2017. And this is a way of pulling together lots of people with interest from age, condition, third sector organisations, disability, digital inclusion, and sensory loss as well, amongst others. And this is a way of us being able to capture their views, and also views of all their connections as well as we're developing the app. We've had a user research lead and user experience lead in Kainos, is the company who've been developing the app with us, who developed prototypes for us in Figma. And with that, we were able to get about over 50 people involved in one-to-one observations as they develop the prototypes. Then we can test, does this make sense to people? Are things in a logical place? And then through that work, it means that we can then keep iterating the development of the app to make sure that it is fit for purpose. Once the app has gone live, we've also been capturing feedback on the features to make sure that they do work in a live environment. And so we have various mechanisms within the app to allow you to give us feedback. As I said, we have a register your interest form. That means that we can contact you when your GP practice is onboarded. We have an in-app feedback button, and that allows us to look at issues, feedback and sentiment analysis, including if there's a technical issue or an IG issue or a clinical risk, then we can capture some of that information as well. The review intercept poll is a pop-up that comes on when you log in first, and that allows us to capture if there's any satisfaction on you using the app, and we'll actually keep asking people every 3 months what they think of. As part of this work, we've been developing sign-up surveys so we can test the features with a small number of people before going live as well, which has been really useful. So what do we do with all this feedback? Well, we've been having daily wash-up meetings to go through and triage what sort of comments they were getting back, and a majority of the time, out of the feedback that we have received, there's usually 2 or 3 things that we've been picking up as well, which has been really useful for us to then go back to the third-party suppliers to make sure things do work. A new function that's just been launched this week, and would be really grateful if people could log on to the app, is user research panels. So this is going to be a way of us being able to capture people by their GP practice with all the skills that were requested in the user involvement survey. So, for example, if you're a carer, you have a disability or sensory loss, or you don't feel comfortable using digital, there's a whole load of questions that we're asking people, so that we can then try and narrow down if there are bits of focus group work that we'd like to do with people. We can then target you in a much more easier way than we can currently. We also have a user design group, which allows us to have people in there to assure the look and feel, the content, colours and navigation of the app. And that's a really good way for us to make sure, again, not only that it's fit for purpose from a patient's point of view, but professionally as well, that you can look at it and it's following the WCAG guidance and Welsh language, an easy read as well, which is really important. On to the next slide. I think it's Laura's video.
Hold on, just need to grab up the video. For some reason, it's not working. So sorry.
Don't worry, Laura.
Might just have to talk to us, Laura.
I know. Oh, absolutely criminal. Right, I'm going to switch my camera on then. I might as well do this in person. To be able to show you all a video that I'd sort of pre-made. So hi everyone, I've as Jo mentioned, I've been working with her for the past couple of years to run through sort of the digital inclusion side of what we do at Digital Communities Wales, and to make sure that all of those considerations are made when it comes to the NHS Wales app. Jo's already talked quite a lot about the Patients and Public Assurance Group. And so I won't go over that in any more detail. But what we have talked about in quite a lot of detail from an inclusion perspective is making sure that we're empowering communities and organisations across Wales, whether they're health sort of focused or whether they're community focused, and making sure that they've got the skills and the knowledge to be able to help others to engage really well online. And one of the things that has sort of come out of that is our digital inclusion roadshow specifically for the NHS Wales app. So we look at digital inclusion as a whole, but we look at it through the lens of the app. So what we're doing is we're reaching out to our established community organisations, clients, and hopefully you guys after today, to upskill people who provide support on the ground. We know that the rollout of the app is going to be huge for being able to streamline a lot of different things within health and hopefully social care in the future. But we can't put all of that digital inclusion pressure on the frontline staff within GP practices, within sort of primary care. So that's why we've developed the roadshow. The idea behind it is to give opportunities, again, within the lens of the app. So it's things like how you navigate around really easily, how you keep yourself nice and safe online. The app is only one way to get in. The other way would be through the web browser. So obviously for people who don't have their own devices, if they're going to their local libraries, then giving them good online safety information to be able to securely access the app and all of its features from there. So we are delivering the roadshow in collaboration with Joe and the team. We're delivering the sessions online within, and what we're doing is we're targeting key areas that the app is already rolled out to. We know that it isn't rolled out sort of nationally just yet. That's fine. We're working really closely with DSPP to make sure that we're targeting the geographical areas that the app is available in, so that we're getting the best use of people's times out of it. So I think that was it, Joe. I will share my screen again. That all feels fairly familiar, but I will reshare my screen and yeah, you can carry on with the last couple of slides.
Oh, thank you very much. I don't know how much to get back on this one.
Thanks, all.
Thank you, Laura. So
move that along. You don't need to see my face twice. There you go.
Right. So what I wanted just to show you was the plan for public beta. So I said we've got 25 practices have gone live for Sejudim, which is one of the GP systems. We've evaluated with the 3 UMIS. We now have 50 have gone live last week, and next week is another 50 practices, and then another 50 to the end of November. So as you can imagine, there's a lot of work going on behind the scenes. We have been encouraging people with My Health Online accounts to log in, but also if you already have a NHS login, full credentials because you had the COVID pass, then you should be able to get in as well. So there is going to be work going on called WIVS, which is the Welsh Identity Verification Service, which will allow people who don't have a photo ID to find a way of being verified. And we're also in the future, we're looking at 12 to 16-year-olds being able to get into the app as well. We also support patients and the practices in different ways as well, not only with the training, which is really valuable from Laura, but we have a GP practice toolkit for the practices. We have the app help and support pages, and you can see the links on here. And we've been doing demonstrations with practice staff as well and getting feedback from them. On to the next slide, Laura. So just thought it would be useful just to show some of the public beta user feedback. So this is what we get from our feedback mechanism. So we can see the user satisfaction every day, and then what areas people are actually giving us feedback on. And as you can see also from who's used My Health Online previously, there's usually 60 or 70% split between have used it and haven't. So which is really encouraging for us. And then the next slide. Just give you a little bit of the comments that we get. So I think some of the comments are that it's easy to use, and people are really finding it really valuable that they can see their health records and prescriptions. However, there are also the negatives that the appointments, for example, aren't available online, but that's for the practices to be allowed to switch on and switch off their functions due to their the way they work. So I think that it's also very encouraging that we can see feedback directly from people which probably hasn't been captured before. So again, these are really important messages to give back to the NHS as well, on what people do want to see in future. And next slide. And then finally, really our priorities for the next year are to get the app deployed across the whole of Wales, improving the services, looking at transition into digital health and care Wales, making sure we're collaborating with strategic programmes, health boards and trusts and third sector organisations on what we're developing, looking at new features and supporting integration. And key for us really is the user research and user experience testing. And finally, really important is encouraging public use of the app. Thank you.
Yeah, thank you, both of you, and thank you also to Carolyn. So we have Mike Emery now, and we've got him for a little while. He's joined us by a piece of string and a tin, I think, but we're going to come to him in a moment. But before we do, let's just questions for Carolyn and Joe and Laura. I guess for me the message here is that things are now happening, quite significant things are happening for patients and staff that are digital, particularly in health, which is where this focus has been really so far. And we've heard a bit from Joe about how on the app side, we're trying to pay attention to what to make it usable and easy to use for patients. And from Carolyn, some fantastic work that they're doing in how they're recognizing that they have staff, not just patients, who are digitally excluded. So any questions? There was a rather curious question, which I think was to Caroline, about whether you're going to move into master's level education. What was the answer to that? Do you give talks to master's students? And I suppose, perhaps more specifically, are you contributing to the Intensive Learning Academy on digital leadership and transformation that's run by colleagues in South Wales?
So I'm always happy to support anything that help raise awareness of digital inclusion, and it's an important point actually, because it's something that we need to kind of embed with our medical students and staff nursing cohort, because if we can make them aware as early on as possible, it just supports the thinking, doesn't it, and the way that they approach things. So yes, I'm open to do that, no problem. And the second question then, I think, Hamish, was no, but again, happy to support.
I mean, I guess the question is how we raise awareness of the approach and the commitment and the investment that's being made in how they are on for digital inclusion for patients and staff, and to see that being adopted more widely by other health organisations in Wales. And I wonder, for example, whether you presented to digital directors, whether you've had a chance to talk to them about what you're doing, whether we should see if we can organise that.
I know Anthony has made them aware, and I think we've had a number of conversations. Both myself and Michelle have been asked to talk to a couple of the health boards. CUMTAF, University Health Board, have reached out to us, Betsy, and I'm trying to think of the other one. But I think at the moment, sometimes it gets thought of as being, oh gosh, it's going to be a very expensive thing. But actually, it's sometimes the simplest thing. So, for example, we make sure that if someone's bringing forward an idea that they want to do that involves digital, one of the things they're asked at the beginning of their journey is, how will you ensure that you don't exclude people? So we take responsibility for saying digital may exclude some patients, so you'll still need to maintain providing services for those who choose not to, potential, or actually, we've still got a number of areas in Wales where, there's the mobile phone signal isn't good enough to carry a decent call without it breaking. But we'll get them to think about that as part of their design process.
Excellent, fantastic. I've got a couple of questions up. I didn't see the sequencings of giving. David, should we start with you? You're on mute.
Yep, got it. Thank you, Hamish. Joanna, I'm fascinated by this question about user-centered design. And the question I've got for you is, in terms of the app launch, I understand the idea of a soft launch, which I've normally taken to mean that you don't make a big song dance about it, and maybe you launch with very minimal functionality just to show you get something done, which I think that's kind of the classic GDS approach, which is great. But the way that you seem to go with a soft launch for the app was it was a soft launch in the sense the number of GPs that were signed up. So I think at the point of launch in April, there were 3% of GPs were connected. And what I found interesting there was that you launched it, you said this is available, it's available in the app stores, the PR went out, and then did you find then that when people signed up, and obviously the 93% of patients in Wales that would have signed up that couldn't get it to work, in the sense, you define, does the thing work? And it works if it gives you a result. It works if it gives you a benefit. It works if you can put a repeat prescription, etc. Did those people come back after they found that it didn't work?
Yes, yeah. So that's what we've been gathering the feedback to make sure that we could test things. As you can imagine, that because we had to do it in a live environment, there are things that we don't know that the GP practices can change things themselves. So we had to make sure that those connections work for a patient in whichever practice they go into. And again,
do you use that? Sorry, do you use that in terms of your metric reporting then? So are you able to give statistics that say this is the number of people that signed up at the point that the app wasn't working for them, and this is now the number of people that are using the app? And is that figure growing faster than the overall user base in terms of transactions compared to, say, My Health Online?
That's one of the things we were struggling with, because the data that you get out of the GP systems is exactly the same if they use My Health Online or they use the app. So that we don't know yet. We can see from the breakdown that we get from the logs server that's developed the app, how many people have uplifted to be using the app. But at the moment, for transactions, it's quite a difficult thing to measure.
So broadly then, what percentage of repeat prescriptions in Wales are done through the app?
I don't know. There's
50%, is it a 5%? Are we?
Again, well, it depends, because we've got 50 practices. So we do get a figure, a daily figure on how many interactions there've been by a distinct count. But that covers only the 50 practices that are live, not all 378 of them at the moment.
I mean, the interesting thing, David, on that, and I'll move us on now, but is that the bit of functionality that GPs have almost all turned on historically is the ability to order repeat prescriptions. There are only 2 practices in the whole of Wales who, for some reason, best known to themselves, have not turned that on. But all the others, if you look at all the other functionality in My Health Online, large numbers of GPs haven't turned quite a lot of it on. But the repeat meds is the thing that will drive the use of the app, because My Health Online is being turned off. And so that's how people will get their repeat meds. Emma from Good Things Foundation.
Yeah, thank you so much, all of you, for those really, really brilliant presentations. Actually, just on that GP point, I think that is, that really is one of the challenges in terms of people's experience about it in communities, and also the experience of like community organisations who are then having to respond to local needs when people are going, oh, this is happening, how do I use this? And that difference, I suppose, the ability that GPs have to go, we'll use this, but not this, and what that then means for trying to get kind of national take up and confidence and trust that, I mean, that it's a massive issue, I know, for us, in England. And so I kind of just keep looking with interest over to the development of NH Wales app in terms of being able to go, you've got it better over here. So I'm continue to be really interested in how it develops, but I know that is a real barrier. And Carolyn, I was so interested to hear about all of the work you were doing. And in a way, Hamish kind of answered a question that was in the back of my mind, which is kind of, are you the stellar leaders on this in Wales? And I think, Hamish, your point about how you kind of, you've got a very clear strategy that is covering all bases, that's really trying to think about it, as you say, in terms of workforces as well as, patients and carers and people. And I think one of the risks that we have across the whole of the UK is how you then support that wider take-up. I was at an event in London yesterday, which was the King's Fund Health and Care Congress. And I was like, oh, again, here on the panel are the same people who would have been on the panel talking about their work a year ago, 2 years ago, 3 years ago, you know. So I think that thing about how you know, your approach can be picked up by others just feels so important. And the only bit that I couldn't tell from the slides was about how you are linking in with local authorities or voluntary community sector organisations and seeing your role as part of a wider ecosystem of support for digital inclusion. So I'd be really interested in hearing about that at some point.
Can I think answer that one just a little bit, Hamish? Have we got time?
If you're very brief.
So I don't know about Sally, but I know there's some good work that's been done in Cardiff and Vale and Betty and Swansea. So we've all got elements of good work, and it's just about us really, I suppose, perhaps what we need to do is forming a bit of collaborative at a health board level and having distinct groups. So I'm happy to talk to Michelle about how we support that. And then quickly in terms of the local authorities, third sector, absolutely we depend on them. The regional steering group which we set up, which did take a bit of hard work and coaxing and lots of nagging to get people around the table. So it truly was a kind of regional approach, has been the thing that we feel is going to have that ability to embed things for us to share the knowledge and learning amongst all those organisations who have the opportunity to support people in our communities.
Thanks, Carolyn. Kristen, have you got a quick question? In which case I'll invite you to ask it now and then we'll move on.
To be honest, I don't know if it's going to be quick or not, but I'll ask it quickly. If the answer's too long, we can leave it.
Fantastic. Great compromise. Good.
Yeah. So basically, our health board, I work in Velindre Cancer Centre, and we've actually started doing some work now on PROMs, so patient-reported outcomes. There is talk there of the PROMs actually being filled in by the patient through the NHS Wales app. So I was just wondering if there is any sort of development on that coming up, or if you're cited on that, is there any plans at all for something like that to happen soon?
Yeah, absolutely. There's some work going on as part of a Pathfinder with Cardiff and Vale with my clinical outcomes. So that's been ongoing for the last couple of years as well. So yes,
great.
Interesting.
Has anyone from Velindre linked in with you about that at all? No,
not yet. I think that's So.
The people to link into would be the Pathfinder project.
Yeah,
Kristen, I can also help you with that, so we'll pick that up afterwards if we may. But
that'd be fantastic. Yeah.
But you've highlighted an important point. So just first of all, a technical thing, because there's a lot of technical stuff in Joe's talk. There's no reason why you would know what an EMIS and a Sedgwick in practice are, but they're just two GP systems. One uses half of Wales uses one, half of uses the other. And the second thing is to say that I don't want you to go away thinking this is a thing for GPs, because it's not. It's a thing for people. It happens that a lot of the initial functionality will be general practice related. But actually, the great thing about the way the NHS Wales app has been designed is that it can essentially plug and play all sorts of things. And an example being you can, and indeed I have updated my organ donation status through it. The idea is it is a thing to which other things can connect, and it's a single gateway with a single login. I'm going to move us on because otherwise, Mike, it's lovely to see you. You're probably moving only at 20 miles an hour in your car, which is good. So an introduction to Mike Emery, for those of you who don't know him, very kind of you to join us. I'm sorry it's been difficult for you. So Mike is the Chief Digital and Innovation Officer for Health and Social Care in Wales, sitting in Welsh Government, and is therefore the kind of owner of the digital health and care strategy that finally came out quite recently. And so we've talked about it a lot in these meetings, waiting for it to come. So it came, it's in the chat if you haven't seen it. And Mike, you're very kindly going to say a little bit about it, I think. Oh, said we can't hear you. Oh no. No, that you're off mute, but there is no sound. The irony of the level of digital exclusion you're suffering from today is not lost on us. No. That's something that says you're connecting to audio. That's a good sign. Except you're not. No, a little tick came on saying,
any luck?
yes.
Oh, right. I am immensely embarrassed around my lack of digital competence. I have tried several different devices. I have no idea. I am learning around the maturity of Welsh Government digital devices. Apologies to all those that come from Welsh Government, but I've learned a lot today. Right, I have a set of slides, and as Hamish beautifully introduced me, I will whiz through some of this. I mean, presenting the strategy, but also talk a little bit about digital inclusion and a few of my reflections. So I'll try not to gabble quickly too much. I've had a bit of a day of it today, but in a positive. I actually was with the minister this morning, and we did touch on many things. One of them was the digital app, and we were talking about the potential that it has to really really bring a lot of services closer to people, if you like, and more accessible to people. So I think I just wanted we're getting to that in a minute, but just want to emphasize, one of the things is we can talk in a negative form around digital exclusion and inclusion, but things like the app also open up a world of opportunities around greater accessibility to services as well. And I do want to emphasize that as we go through. So anyway, first and foremost, lovely to be here, and it's a real opportunity. You are one of the groups and alliances I really want to make a connection with, and I've been here 7 or 8 months and royally failed to do so, but hopefully I can do more of that as we go forward. Just first, if we move to the next slide, just quickly my role more broadly on the next slide, just outlining my role on the following slide. So those who don't know me, I'm the Chief Digital Officer for NHS Wales. That means I have oversight across the system, also director within Welsh Government, have a strong background right across public services, which I think is really important because we talked earlier on around the connection to social care and community services. I think that is essential around when we're looking at some of the digital services and platforms we need to develop and how we link into various organizations. You need to understand that wider footprint. My role is very much looking at the wider national policy and strategy. It's digital and data strategy, innovation, life sciences, and that system-wide governance. But probably the important thing, I suppose I own largely the health and social care monies and funding streams that we provide to various national programs, particularly one of them being the NHS app program, along with the monies we put into the digital inclusion program. So just some reflections from me if we go to the next slide. I think it is important when developing our digital strategy and priorities to understand, the context that we're currently operating in, because it does impact on how we develop our services. In Wales, as you all know, we've got huge challenges ongoing around our changing demographics, major impact with regards to rise in, long-term conditions, the figures and the pressures related to, for example, diabetes are well rehearsed. But also in Wales, we have significant health inequalities, often more extreme, if you like, than other parts of the UK, which is something we need to think through more broadly and think of different ways in which we can deliver services, whether that be digital or if delivering services in a digital way, how do we ensure people aren't left behind? But we have huge opportunities to respond to this. I think, the data we're beginning to collect, we can really start to use that to identify, for example, where those inequalities lie and where we can do some targeted interventions. And that means, on issues around digital inclusion, where are there potentially pockets of the population that if we gave them extra training or support, they may be able to access services online or maybe able to receive information in a different way. I think it also presents huge opportunities, even things like technology around drones. People laugh at me sometimes when I talk about drone technology. Actually, it's being used in the, globally to provide services and drugs to potentially more inaccessible areas that you wouldn't have thought in the past you could respond and provide those goods, if you like, in a more timely way. But we're under huge pressure. We've got to look to do things differently. We can see the pressures in social care. Staff particularly have suffered over the last few years. Anything we design and do and deliver, like the NHS app or clinical systems, we've got to design in a way that they don't add additional burden to both patients and clinicians. And that's why that whole focus on user-focused design is absolutely key. But we're in a rapidly, but there are huge global pressures on resources are affecting, particularly the IT world and some of the infrastructure and devices we deliver, huge inflationary pressures. But more broadly, the money is an issue. How do we continue to meet increasing public expectations about health services and information when the public pound is increasingly stretched? And digital delivery is part of that. But again, we mustn't leave people behind. So it probably takes us to the next slide about, well, how are we responding to these challenges? And actually, joining Wales health system earlier on in the year, as I did, I actually went back to the Healthier Wales document, and I know there's been lots of talk, what's happened to this, is it still relevant? And actually, if you read, the thrust of that document, it is still very, very relevant. We are, and we need to support people to stay well. We need to take a person-centered approach. That's what the NHS app is all about. But it's also about ensuring that we're not leaving people behind, and people, by designing new services around care closer to home, and delivering that in a different way, we've got to make sure those more vulnerable groups are not ignored. And that is the danger about looking at the latest technology in medicines. And that's not only from a patient point of view, but obviously staff as well. How are we helping them to upskill their knowledge base? So I wanted to sort of take us right back to those, what we're trying to achieve with all this work we're doing, which is very much trying to make our populace more healthier and wealthier, if you like, in the long term. So if we move to the next slide. So, but there are, as I say, key risks in trying to deliver this. You've already mentioned connectivity is a huge barrier. I actually think it's a huge public health issue that, if we have what I call these not spots of connectivity, we need to be working together across public services to overcome this. We need to be actually engaging clinicians and users and patients with regards to what they need and what they require for things like the NHS app. And it's also important that, we're linking together and working in a networked way, not that it's top down. I think that's, as shown over and over again, if you drive things solely from the top, you have to set standards, yes, but you need to be engaging people from across different organizations. And finally, what we hear about is, how do we support people whose digital literacy is perhaps lower, or they can't afford the right broadband access, or they can't afford the devices? Which brings us back to one of the challenges, and the major challenge at the moment: public services are broke. We haven't got a lot of money, but one way to solve that is to deliver services in a different way. And that's why digital transformation, I believe, is absolutely key to that, which makes services more accessible and hopefully will ensure that we can reduce demand on things like GP practices and A&E in the long term, which is what we're all about. So if we move to the next slide. So I will get into the strategy, but I know you all know this, but I'll just you can read this, I would share the slides. But I also want to sort of say that, you know, digital inclusion, by doing what we're trying to do, there's a real, it's a business imperative. It's not a nice to have. And I think that's really important for us to constantly reiterate that. It's about, by giving access to information, which we're trying to do via digital services, it allows people to manage their health in a better way. By improving and developing digital services like the NHS app, it's actually increasing access to things more in the long term with regards to services. And, you know, for people as well with things like disabilities, actually, it can increase people's inclusion and access to services. So my daughter, for example, has learning disabilities, and up to now, sometimes she struggles to access services. She's about 16 now, but she is learning to use technology, smart technology, to counter steps and to manage her long-term health. Because she struggles to understand things when talking to me in a complex way. But when I talk to her about, if you walk 10,000 steps, you can maintain a more healthier lifestyle, she has a watch, she walks, manages a number of steps, and she's leading a more healthy lifestyle. And she also finds it easier to look at images and visualizations of you know, heartbeat and her calorie intake. Maybe that's not a good thing for a teenage girl, but it is actually helping her to think about that healthier lifestyle, and videos as well, rather than reading things which she finds complex, also allows her to, you know, look after and self-manage her long-term conditions. So I think it's important we think about how technology can also be a good thing for those who are disadvantaged, as well as potentially, as we talk about, being something that can be a barrier. So if we just move forward to the next slide. I'll just whiz through. If we move forward, that's the slide. I just wanted to talk very quickly. So we did publish the strategy. It's taken a long time to come through into publication, but the thrust of it will be nothing that anybody wouldn't expect. It builds on previous documents. It stems from Healthier Wales, and more broadly, the Welsh Government digital strategy. But I think the key things I want to emphasise is front and centre of that, along our key objectives, is user-centred digital services and the importance of digital inclusion, and about ensuring we embed that and mainstream that in all our thinking around, for example, business cases and investment cases and the decisions we make. So if people cannot demonstrate they've taken those things into account, then those business cases or investment decisions that need to be made will be pushed back to those people to say we need to think through in a better way how we take on board these issues. If we move on to the next slide. So where next? I've talked about the importance, and there's a whopping great big typo there, so apologies. The importance of ensuring that we inform, we make sure we have informed investment decisions going forward that take account of the challenges and barriers around digital inclusion. We need to be working with Health, Education and Improvement Wales around upskilling staff around digital literacy. During COVID, for example, I learnt my lesson when we tried to deploy 300 iPads to care homes to enable video consultations and the like in care homes. We assumed everybody could operate an iPad, and that was a foolish assumption, and discovered quite quickly that we should have done a lot more training to help people, talk people through how they turn on the iPad, how they download apps, and how they undertake video meetings. And as I demonstrated today, that they were not the only ones with the difficulties of accessing things like Zoom. We're going to put in place a new national digital board that will make investment decisions in the round right across every portfolio of work to ensure digital inclusion is front and center of all those decisions, but also user-focused research. and we join up all our clinical systems, if you like, and the app is at the center of that. You know, the app has to be the front door for us, and it has huge potential to make information and you know, things like repeat prescriptions accessible to all. And so, and as I said, you know, working with you to develop things like the digital inclusion guide, etc., for health and care in Wales. So all really important things. So if we go on to the next slide, just sort of rounding up slightly, what was really heartwarming for me coming to Wales from England is that you exist. And I'm not trying to, well, I am to a degree trying to curry favour, but I think it's so important. It sends a really important signal to the system. We have that alliance. We have work going on in the health boards. You know, I come from a system that is very much more fragmented. I originally came from England, and there wasn't, you know, this kind of, you know, national leadership. So really important for me. You're there to advise, champion, and undertake support to a lot of organisations, and I want to work with you to really sort of help fly the flag and get health boards and local authorities working with you on that going forward. Finally, the last slide or so, and I'll finish and actually use 5 minutes to questions. We moved on quickly. That was to re-emphasize the point about making sure we're user focused and understand where people have challenges with regards to accessing services. But if we start with the person at the center and build out from there, we're more likely to have successful digital delivery, as many of you will know. On to the next slide, please. So finally, this is very much taken from the work you're doing, but I wanted to emphasize there is more to be done, but we're on the journey. But it is really positive that we're starting to tackle some of these issues that we've got. And it will be at the heart of everything we do. And I really want to open up the dialogue now going forward. I unfortunately only have a few minutes now in how we can, as I say, sell this. So when I go, for example, and to various wider NHS Wales conferences around what our plans are going forward, how do I work with you to ensure we don't lose this strong message in, for example, planning frameworks, the requirements of digital directors and the like, because it has to be at the core of all our digital strategies and plans. Okay, I'll probably stop there if that's okay.
Mike, thank you very much. We're very grateful for you for making the time and for giving us that overview. And it's great, I think, for colleagues to work. I'm conscious of our agenda a bit as well. Can I suggest, Mike, that what we might do is get you back? Well, first of all, we'll follow up with you, but we'll get you back when you're not having to sit in your car, and we can have a proper conversation with you. Would that be okay?
I would really like that. I can only apologise for the rush nature and the problems I've had, and I would really enjoy almost like a proper session where we can, you know, really unpick some of the issues with you. And I have very much an offer to you all to do that. That would be really good.
I think we'll do that. And just some of us have seen NHS England have recently produced some digital guidance for GPs, for example, and the role GPs can play in digital inclusion. That'd be something quite good to explore with you as well, I think.
Would.
Mike, I'm going to thank you and let you get back out of your car into your office, and we will arrange for you to come back there. We'll have a proper chance to have a conversation, I think, if that's okay.
All right. Thank you very much. All right. Cheers.
Lovely. Thanks. Bye, Mike. So that I guess the message is, you know, there's more digital coming, and therefore we definitely need to be focusing on inclusion. And I thought there's some important messages from Mike, not least the thing that we've been banging on about for a long time, which is, you know, business cases for investment in digital need to have an explanation about how people are going to be supported to use them as part of them. So really encouraging to hear that, I think. I'm looking to Sarah, this has been a difficult agenda to manage. I think we're going to go quickly into breakouts. Just for a few minutes, we'll condense some of the rest of the agenda, because we really want to know if you're involved in any digital health and care related projects, and if so, what are you or your clients, service users, communities finding difficult about engaging in health and social care projects as well? So the very specific question. We're going to do that for 7 or 8 minutes, and then we'll come back to hear from Sarah. Is that okay? Not enough time, but actually we got some rich discussion in a short period of time. I hope you did too. And clearly there were some pretty common themes actually, I thought, emerging too. Sarah, you're going to very quickly talk to us a little bit about our impact measurement.
Yes, very quickly. In our last meeting, we talked about how we're going to measure the impact DIAW is having on digital inclusion initiatives in Wales. I'll share some larger information about it, what we're planning to do in the follow-up email. But essentially, we're going to do a live poll in each network meeting about the outcome or about the priority that we're focusing on in that meeting for you all to answer. So we'll go to a poll in a moment. I'm also going to be trying to create some case studies. So if we have any volunteers for people who are doing work in this area who want to be involved in a case study, there's a question in the poll about that. And we've already also talked about the possibilities of a working group for each priority, which meet outside the network meeting to discuss action in these areas. So there's a question in the poll about that as well. Even if you're not sure, tick yes in the poll and you can find out more information about it. The other thing we talked about in the last meeting was about measuring the impact of your own digital inclusion initiatives. So Good Things Foundation, Digital Communities Wales and the Alliance want to support you all in doing that. So we've created a survey, which I shared already, but if you haven't already answered, we'd really appreciate your feedback on that. We'd like to create some resources and guides to help organizations in the network to figure out how to evaluate their own initiatives, even if they're sort of low on resources and capacity to do so. And we want those resources to be as useful as possible. So the more answers we have to that survey, the happier we will be. In true Sarah style, I am now going to try and launch a poll, which I've never done before. I love doing this in these meetings. If it doesn't work, I do have a backup plan. I will share a link in the follow-up email to a form you can fill out online. But I am going to launch the poll now. I'm hoping it works.
Yep. And
I will give you 5 minutes. So if you can just work your way through the questions, it shouldn't take too long.
There will have been lots of really good examples, and it would be great to even if you think they're only small, it'd be really good to be able to capture those and share them. We definitely need to be sharing the work that Hywel Dda are doing, for example, that we've heard from, but lots of other stuff. 2 really good examples from social care in my little group, for example. So really keen to capture them and share them, and that will help our impact.
Yeah, hopefully by doing this, we'll be able to sort of document some of the work that's going on now. It's sort of a snapshot in time for this quarter for priority 2. And then the next time we come to look at this area again, in the next time we do a network meeting on this, we'll be able to have some quantitative data from the poll and some qualitative data from a case study to see how far we've come. I'm also looking to do some content analysis of recent policy and strategy documents that looking at whether the mentions of digital inclusion and connectivity and things like that are coming out more and more in relevant documents. So this is the sort of thing I'm going to do every quarter. So whatever we focus on next quarter, I'll have another poll trying to discover whether network members think that we are working towards our outcomes in that area.
Fantastic. Sarah, thank you very, very much indeed. Thank you also to Rob, who's posted something very interesting in the chat, and that'd be something we'd love to talk to you more about, and we can perhaps help to share that with network members who aren't here today. We were asked, although we're focusing on health and social care in this session, there was a kind of time critical thing related to something that wasn't to do with health and social care, but colleagues in Welsh Government were keen just to talk to us about. So we've just got a few minutes, and I think Chris James from Head of Civil and Administrative Justice is going to speak about it. Is that right, Chris?
Yes. Hello, Hamish. Thank you very much for the. Can you hear me okay?
Yes.
Yeah. Thank you very much for the opportunity to attend your meeting. It's been a busy agenda, so I'm grateful for the few minutes that you've given me. I just wanted to talk to you about a tribunal reform work that the Welsh Government has embarked upon. I did do a short presentation, but we've only got a few minutes, so I'll just talk and I'll provide it to Sarah, who can circulate it separately if that's helpful. I think from my perspective, it's been interesting to hear about the experiences of digital developments in in the health and social care sector. The work that I'm doing cuts across that to an extent in the fact that it involves the Mental Health Review Tribunal for Wales, so there's an interface with Health Matters. But basically, what we're looking at and the project that I'm involved in is a review and a reform of the devolved tribunals in Wales. So currently, there are a number of devolved tribunals, of which the Mental Health Review Tribunal is one, that all operate on a very separate basis. Some of them are drawn together loosely in a sort of confederation and administered by the Welsh Government. And there is a president of Welsh tribunals that oversees their operation. But they lack coherence and they lack the benefits of kind of closer working relationships in the way that resources can be allocated and members can work. There have been a number of studies that have looked at the system of devolved tribunals. I suppose the most significant was a study that the former Lord Chief Justice, Lord Thomas of Cymru did in 2019 that looked at the justice system and how justice interfaces with other devolved services like health and education. What we propose is to take all the separate devolved tribunals and to unify them into a single tribunal, the First Tier Tribunal for Wales, which would be divided into chambers, a bit like the First Tier Tribunal that currently exists in England, that will be responsible for particular jurisdictions, like the Mental Health Review Tribunal or the Education Tribunal, and to unify the systems for appointing members, for example. So the idea is it creates a more flexible system that's able to respond to the change in legislative landscape in Wales over time and add more jurisdictions to it or different rights of appeal. In terms of digital inclusion, one of the proposals that we're recommending is the creation of a Tribunal Procedure Committee for Wales, which would look at setting more modern tribunal rules to make tribunals easier to navigate and use for tribunal users. And whilst the work that we're doing really doesn't focus on the kind of operational aspects, if you like, it would be for the Tribunal Procedure Committee to consider digital means for accessing services. Obviously, the tribunals operated on a digital basis during the COVID pandemic and still continue to operate to an extent in that way. But I think it's interesting as well, the interface with the Welsh Government's digital strategy for Wales, which makes clear that people who cannot or decide not to participate digitally, must be able to access services in the same way. So it's about a user-centered delivery of service. So I think that will be one of the overriding objectives that our Tribunal Procedure Committee for Wales will have in mind when it's setting rules. So we ran a consultation. Again, I'll perhaps include the link to that in the chat, which actually closed on the 2nd of October. So we're in the process of developing legislative proposals. There'll be a bill at some point, hopefully in the Senedd, to take these reforms forward. We're very much interested in ongoing engagement with anybody on our proposals, despite the fact that the consultation's closed. We've got a long run into to any legislation, so we're happy to talk to anybody that might have an interest in terms of the justice angle. And as you say, we'll be looking at a bill in the Senedd, so up to it would need to pass before March 2026. There'll be an implementation phase which will follow before a new system becomes operational. So that's kind of what we're doing in a nutshell. we're obviously happy to take any comments that you have at a later stage, and to continue to engage with anybody that's kind of interested in this element of work. And thank you for the opportunity to talk to you.
Well, Chris, thank you very much indeed. That sounds very interesting, and I would hope and suspect that there will be members of our alliance who would want to have a chance to respond or contribute, engage with you on it, even if they didn't have a chance to do so or didn't do so through the consultation. So, could I encourage people? Should they? How would you like people to get in touch with you? What's the best way of doing that?
Well, if I'll provide my details to Sarah, and I'll pop details in the chat bar as well. So email address and so forth. And as you say, we're happy to to have any comments or talk to anybody that wishes to talk to us. So so hopefully that's helpful.
It is. I would imagine, this is just speculation, but I would imagine that users of your tribunal service are likely to be people who have a higher rate of digital exclusion than the normal population.
Yeah, I think that's the case, Hamish, certainly for some of the tribunals.
Yeah.
Looking at, say, mental health tribunal, for example.
Yeah. It's definitely something that it's good to hear that you're putting a focus on it, and I say there will be colleagues in the network who perhaps work with some of the people who will be using your tribunals and might want to specifically comment. I would encourage people to do so. So thank you, Chris, very, very much indeed, and good luck with what seems like probably quite a challenging bit of work. We'd love to try and help you with it. It has, as Chris has said, it's been a slightly chaotic, agenda today, but in amongst all that, there's been some very good stuff. I can't emphasize enough, we know that users of health and social care have a very high rate of digital exclusion compared to the average population. So it's really good we had a focus on this priority today. And also really nice to hear some very positive things being done to try and address it. We'll work out a way of engaging with Mike Emery in a slightly more effective fashion at a future event. But as always, thank you so much to everybody for your contributions. Some great stuff in the chat. We'll try and capture that, and we look forward to seeing you next quarter. And in a spirit of true democracy, you're going to determine what it is from your poll, what it is we talk about. So we'll keep it a secret for now, but Sarah will tell me what you voted for shortly, I'm sure. Thank you very much, and thanks to Sarah for holding it all together with a lot of moving parts today. Nice to see you all. Bye-bye.